Hi everyone, my name is Katie Vu and I'll be covering the second part of syphilis, agent of disease, signs and symptoms, and the mode of transmission. As you can see, both graphs shows the rate of reported cases among females and males aged 15 to 44 in the United States from 2008 to 2017. This disease has been increasing for the past few years, and in 2017, female ages 20 to 24 are reported to have the highest ranking of syphilis, and as for males, aged 25 to 29. Agent of disease. Syphilis is a sexually transmitted disease that is caused by the bacterium known as Treponema pallidum. This bacterial agent can be transmitted from person to person via direct contact. And if this disease is left untreated, it can cause long-term health problems, and a person who is living with syphilis has a higher chance of acquiring HIV or AIDS. Moving on to signs and symptoms. Syphilis develops in 3 stages, and the signs and symptoms vary within each stage. Primary syphilis is the first stage of syphilis. In this stage, an individual can develop a small sore which is called canker. These sores appear at the location where syphilis enters the body, which develops within 3 to 4 weeks after the exposure, and there are no signs and symptoms presented. The second stage includes rashes that can eventually cover the entire body, but these rashes do not cause any irritations or itchiness. There are many cases where some experience hair loss, muscle aches, fever, sore throats, and swollen lymph nodes. In the late stage of syphilis, around 15 to 30% of people who are infected and did not get treatment will develop complications later in life, such as damages to the brain, nerves, eyes, heart, liver, bones, and joints. It is very important to get tested for syphilis to avoid all of these complications and to better protect yourself and others around you. Mode of transmission. The bacteria enters into the body through minor cuts or abrasions in the skin or mucous membranes. And although there are many modes of transmission, the most common route is through unprotected sexual contact with an infected person. And this could be in any form such as vaginal, anal, or oral. Other routes can include sharing needles and pregnant mother passing this disease to their unborn child.